Hello, this is Dr. Virginia Ellis over here at Virginia H. Ellis DDS Dental Corp. Today, I'm going to be talking about gummy smiles. People have been asking about gummy smiles, and I'm going to be giving you a better understanding on this topic. Okay, question number one is, Dr. Ellis, what is a gummy smile and what causes it? So a gummy smile is a smile where people smile, and instead of like having a smile like this, they really show their gums. They have a really high gummy smile, and that you're showing more gums on your upper anterior teeth than most people do. The other question people have is, at what point is a smile considered too gummy? In most cases, it's when it's about 3 or 4 millimeters above over your teeth, and that would be the equivalent of like 2 pennies thick. So if you were to stack 2 pennies thick, that's considered a higher than usual most people's gummy smile. So at the end of the day though, it's really how you feel about yourself. So if the gummy smile doesn't bother you and it doesn't prevent you from your normal daily functioning, like speaking properly or eating properly, you don't have to do anything about it. But if you'd be like, oh my gosh, I don't like the way I look, it really bothers me, then you have some options to look at, okay? What are the most common treatments options for fixing a gummy smile? Well, you have some reversible treatments like Botox. Sometimes you can do Botox shots to paralyze the muscles and allow, instead of the muscles when you smile do this, they kind of go like that, and your lips don't contract as much. The other option, which is more irreversible, is something like if you have an overgrowth of your gums, what can be done is cutting back the gums, because I'm going to show you with this model over here. Sometimes your gums can be overgrown like this. So with me, and some people, the gums are growing way over here. So if you have gums that are overgrown, you could do something like laser surgery to cut back and just kind of show more of the height of the tooth. Instead of having like gums that are way down to here, they can be cut back to look kind of more like mine, right? Like what a lot of people's gums look like. So that would be something like I call that gingivectomy, cutting the gum margin of the gums up a little more so that you can have less of gum smiling showing. Another cause for it could be just the way your anatomy is and how your skull developed during your childhood and your adolescence. So for some people, it's an overgrowth of the actual upper jaw and a missed bite that people have that causes our muscles to attach differently and just pull up more into in the upper lip. So that could be another cause, okay? And this, of course, can cause a need for jaw surgery. So if you have a complex case, braces would be the first step to do it, and then jaw surgery. And that's an irreversible option, okay? Once you do it, it doesn't go back. Okay, so the other question is, how long do the results from Botox for a gummy smile typically last? So basically, if you want to get Botox to paralyze the muscles of the upper lip and kind of keep it down like this when you smile instead of having it go up like that. So that's usually about 3 to 6 months, and then you need touch-ups about every 3 to 6 months. So it's not like a thing that you do once and it lasts forever. You do have to keep touching that up, okay? Can surgery be used to correct a gummy smile? Yes, like I just said, 2 types of surgery. The main ones are if you happen to have an overgrowth of your gums at the gum line for your front teeth like I have over here, then you can do laser or regular surgery to cut back and show more of the teeth and less of the gums, okay? The other one is, like I just said, braces and jaw surgery. So that's a longer process, very intensive and irreversible. All right, the next question is, can surgery be used to correct my gummy smile? Yes, but it is dependent on your particular situation, okay? Sometimes you could do a lip repositioning. I haven't talked about that, where you do surgery to do this kind of stuff. Or the gingivectomy that I just talked about, or the jaw surgery that's usually done after the major portion of braces is finished, okay? How effective are different treatments for a gummy smile? Okay, so basically, if you happen to have a situation where your bite is off or the way your skull and your head formed in your growing years, It's very effective, but it takes a while. Braces first, jaw surgery later, and the jaw surgery is pretty intense, okay? You go in there, and usually they wire your mouth shut for about 30 days, and you're sipping out of a straw, you're losing weight, but the end result is really good, okay? It's just, it's an intense process, and it does require your commitment to it, and it is irreversible. The other one that's also reversible is the gingivectomy, which is where we cut like the gum line up if you have an overgrowth of your gums, and that's only possible if your gums have overgrown too much down into your teeth, okay? So you can only do gingivectomy if you have that particular situation where you can afford to have the gum length or the gum line in your front teeth trimmed back, okay? The other option is obviously the Botox, and the other irreversible option is the lip repositioning through surgical procedures. That would be more done like with someone like a plastic surgeon. Are there side effects or risk of treating my gummy smile? Anytime you do surgery, even when you get those shots with Botox, there's always a risk, okay? Never think that, oh, I'm gonna get this procedure done, there's no risk. That's just ridiculous. Don't ever assume that. Even if you're getting an anesthetic injection, there's always a risk in there. I think we all know that. With surgeries, the biggest risk is infection. So that's just something, you know, anytime you go in the hospital, they're gonna tell you, hey, what's the risk for this? Well, there's always infection. That's the biggest risk. But nothing we do is never without risk. Nothing is guaranteed in life, okay? But usually it's safe, but we can't tell you that there's no risk in there, okay? Side effects of treating a gummy smile could be, they're mostly temporary. You can have obviously inflammation, you can have bruising, a bit of discomfort from the initial procedures, maybe from the shots or the trimming back of the gum line. Obviously, if you're gonna have a jaw surgery, that is major stuff. You will be out for about a month, and that's gonna take a while to heal, okay? That's the biggest one. The results can be wonderful for a lot of people. What is the difference between temporary and permanent gummy smile correction? So temporary corrections last about 3 to 6 months, 3 to 4 months. Those are like the injections for the Botox. The permanent corrections are the irreversible changes that you make in your lips and your mouth and your bite. Examples again are gingivectomies, when you're trimming back the gum. Gingiva means gums in dentistry. So if you're trimming that back, that is irreversible. A lot of times, sometimes it can grow again, but it's usually irreversible. Obviously, having braces causes irreversible changes, and jaw surgery is an irreversible procedure, okay? Can you share what patients can expect from a gummy smile treatment before and after? Yes, increased self-confidence, because it's obviously something that bothers these people. So if you feel like, yes, it bothers me, I really want to change it, and you know, or in some cases it's so big and so significant that in some people it affects the way they speak and the way they bite and chew. That would be a situation where someone would really need that kind of treatment. So it could be increased self-confidence, increased function in the way you speak and you chew your food. So that can be really good. So how do you help patients decide which gummy smile fix is right for them? Basically, it's by identifying the actual cause of the gummy smile. It's not just, a lot of times it's not just a matter of you coming in, oh yeah, we'll treat you this way really quickly. Sometimes you have to take molds, take x-rays, especially if you have a case where the cause of your gummy smile is due to your bite or uneven growth between the upper and the lower jaws, okay? And also discussing your options. You discuss the true nature of the cause of why you have a gummy smile. You figure out your options and what your desires are and your preferences are. Some people say, no, you know, I don't want to go through the surgery. I'll stick with what I have. Other people say, yeah, you know, I really want to get this done, so you do that. So, and some people say, I just want to have, you know, less gum showing on my teeth because I'm going to a wedding or whatever. At that point, you might choose the Botox shots, okay? But if you have any questions, I hope this answered your questions. You liked the video, go ahead and click a like, subscribe to the channel for more interesting and useful information, especially in dentistry. And if you have further questions, check us out at www.orindadentist.com. Our phone number is 925-254-4043. All right, I will see you at your next video to answer more dental questions that are useful and interesting. Bye-bye.